We're going to talk about mental health awareness. It is May and it's National Mental Health Awareness Month. So it's always a great opportunity to talk about it in order to help reduce stigma. And I always like to begin by just providing some information as to what is mental illness and mental health. So mental health is really about your emotions, your moods, your behaviors, and how you're thinking. And we all have it. We all have mental health, and we work to promote our mental wellness. When mental illness affects us is when you're impaired with your thinking, your feelings, your emotions, your behaviors, to a point that you can no longer function appropriately for a period of time. So somebody with depression, well, we all feel depressed, and we all know what it's like to have grief. But if you have major depressive disorder, you're not going to get out of bed for 2 weeks. You're probably not going to be able to work. You're not going to engage in good self-care. You're probably going to isolate, not contact family and friends and people that care about you. So that's an example of when mental, when this is so impacted that it's affecting your quality of life, and that's what mental illness is. So there's a broad category of mental illness, and people lump it all into one. So we have any mental illness, and that's usually more on this spectrum here. And it can be anything. It could be a once-in-a-lifetime mental illness. Say if perhaps I pull out of the parking lot here and I get into a car accident, and I'm so overwhelmed by that event that I have acute stress disorder. I'm having nightmares. I'm afraid to get in my car. I don't want to drive anymore. That's acute stress disorder. That can be resolved within 30 days with the appropriate treatment. If it goes unresolved, it could turn into post stress disorder, PTSD. So that's, you could have, a marriage, say you're having financial issues, relationship issues, some life event, and then suddenly you're depressed. It's the first time in your life you ever had depression to the point that you can't really function, or you have anxiety or panic attacks. So that's any mental illness, and some can be ongoing, chronic. They come back. They kind of like any physical illness where it can be, you can work at it and suddenly it goes in remission, so to speak. But then other things can happen. It becomes acute. Now, the serious mental illness, that's what everybody usually goes to when they think about mental illness, and that's about 5% of the population. And those would be illnesses like bipolar disorder, psychosis, delusion. And those are often very debilitating for people, and it's a lifetime struggle and often very difficult for them to function. So 1 in 5 people have a mental illness. Those were statistics before the pandemic. So that's 20% of the population on any given day has a mental illness. And surprising statistics, 40% of US adults report struggling with mental health or substance use. 1 in 6 youth, aged 6 to 17, experience a mental health disorder each year. Half of all mental illnesses begin by the age of 14. Most people are very surprised by that. So youth can have a diagnosable mental illness before 14, but usually you're not diagnosed till they're in their 20s. The average delay between the onset of mental illness and treatment is 11 years. 1 in every 8 emergencies in the emergency department, I have to tell you it's far more greater than that right now, is related to mental illness, depression, anxiety, suicide.
Why is there 11 years lapse? What's that?
A lot of that has to do with stigma, because people are feeling it. Family feels shame. The individual feels shame. They think they need to suck it up and get through it. For men, it's especially if they're having depression, they don't want to tell anybody. They rather try to use other coping mechanisms, perhaps start drinking to help them feel better, or start using drugs, or engaging in reckless behavior. So that's usually why it takes so long. And then the families, they don't want to tell their families. And then if they do tell their families, the families feel ashamed. So. And then I think a lot of times with younger people think it's a phase. They're going to get through it. It's adolescence, So each day, again, 1 in 5 people, and that was before the pandemic. Every day, 18 to 22 veterans commit suicide. and that's usually due to PTSD and depression. 70% of behavioral health patients have a medical comorbidity, and that's usually some of the medications can be really rough, especially for the serious mental illness, but it also can be due to lack of self-care. You know, if you're really depressed and you're suffering, you're not going to get up and exercise, you're not going to be eating healthy. So a lot of health issues can come about. 10% of the population suffers from substance use disorder. Now the government, who collects all the statistics, is saying it's 14.5% since the pandemic. Almost 20% of individuals have an anxiety disorder. Suicide, third leading cause of death for persons 10 to 24, and the second leading cause of death from 25 to 35. And I was very surprised about this. Of the 67 counties in Florida, Sarasota's 12th for suicide. And then you bright yellow, you can see here, this is from Mental Health America. They collect a lot of statistics nationally. Bright yellow is the highest prevalence of mental illness. And you can see we're pretty bright yellow.
I wonder why it seems to more in the south.
Yeah.
And the northwest is starting to
Yeah.
What's the reason for that?
I'm pretty sure it's access to care.
Okay.
Oh.
Yep.
And the effects of the pandemic. Well, we've seen the headlines. You know, 60 Minutes did an article or a segment just last weekend about how kids are in the emergency departments. I've had a lot of people reach out to me. We have seen a surge in young people being very impacted by the pandemic, and is still really struggling. So. 1/3 of Americans experience clinical levels of anxiety and depression. Crisis text lines have shown a collection of a 40% increase in need since the pandemic. And anxiety, depression, isolation, all the leading factors. I mean, we know what we went through. Just the anxiety when the pandemic initially hit all of us, and we were told to shelter in place and don't go out unless you're absolutely essential, and it was a life or death situation. We just didn't know, and so people had to isolate, and there was a lot of loss. People lost jobs, people lost loved ones, people lost that social connection, kids lost that ability to go to school, and then there were those other losses like weddings that got postponed, graduations that never happened, proms, etc. It was just a lot. There's, people say, well, why does somebody get mental illness? And there's a lot of factors. It can be genetic, it can be biological, chemical imbalances. You know, for example, they always talked about what are the resiliency factors? Why do some people, they can face this sort of situation and come out doing really well, and others really struggle, and it impacts the rest of their lives? It might be the serotonin in their brains, you know, so somebody with a lot of serotonin and the neurotransmitters are working well are going to be able to cope much better than somebody who's not, doesn't have that sort of chemistry happening. So, and then of course there's life events that impact behavioral health, childhood trauma, stress. Stress can be good, but it can also take its toll. And mental illness is a problem. It's a health problem just like any other. And for so many reasons, because of stigma, people don't talk about it. They feel a lot of shame. But it really, just like any other medical condition, it needs treatment. And the sooner you can get treatment to that individual, the better the outcome, just like any physical illness. And again, it's stigma that prevents that from happening. And that's why we use this month to really get out there. And actually, we should use every day to do this. And stigma really is, it's very judgmental and often quite misinformed. And a lot of negative attitudes, discrimination. And you hear the terms, oh, that's, you must be schizophrenic, or you must be crazy, or people with mental illness are violent. And I can tell you, the Executive Director of Behavioral Health Services, and I probably should have started by introducing myself. I'm Terry Cassidy, the Executive Director of Behavioral Health Services here. And we work with, I think last year, we had about 10,000 individuals just in this area that we worked with, helping whether they were in the main hospital here, or in our outpatient services, or over in our inpatient services. Between our doctors, our psychiatrists, 10,000 people that we assisted. And of those 10,000 people, all walks of life, successful attorneys, and teachers, but when you think of mental illness, you know, people conceive a notion. I mean, the first thing you say, oh, this person is mentally ill and they're going to be with us tonight. People jump to all kinds of dark places with that. And that's because of all this misinformation. And then, you know, there's overt and subtle ways that, you know, stigma's there, like the comments I was just talking about. Or then again, the more subtle, the theories that people have, how they think of somebody with mental illness, the myths. And so for us to reduce the effects of stigma, how it impacts everybody. Hello.
Hi.
Come on in, have a seat.
Sit down. We got some chairs. Thank you. You're welcome. My dad did surgery, but it's a coincidence that I got this. My son was bankrupt and I'm trying. He's very ill. Yeah.
Oh, I'm sorry to hear
So
that.
it's good for me
Timely.
to get info. Thank you.
Sure. Okay. Well, thank you for sharing that, because that's what we're talking about, stigma. A lot of people would be very hesitant to come forward and say that. And the more we talk about it, because it affects so many people, the more we normalize it, because it's a, yeah.
Thank you very much.
So the effects of stigma, you know, really reduces individuals' hopes if they have all this misinformation about it. And again, promoting the shame, you know. Think about that. Like if you have somebody in your family with heart disease or going in for a surgical procedure, you feel comfortable sharing that with your colleagues, with your friends, with your support system. But if you have a family member who's on a Baker Act, you know, a lot of people just feel like they have to protect that. They want to protect their loved one. They want to protect their family. And so they feel very hesitant about sharing that information. So it makes them very lonely. I mean, very isolated and lonely. You know, how great it feels to get support when we have somebody that's having a medical procedure, and people might bring casseroles, or somebody might be calling you and checking on you, but when you're really isolated, because, you know, it's just very sad. It also lowers the self-esteem of individuals, you know, because of all that misinformation and falseness that's going on about it, and really promotes people isolating and pushing other people away. They don't get the support they should, and they don't get the treatment and services they should. And it actually increases the symptoms. If you're feeling lonely and isolated and low self-esteem, on top of everything else you're dealing with, it exacerbates it. So we mentioned people often don't get the treatment until 10, 11 years after they have the illness. And just like, you know, the sooner they get help, the better the outcome. So if we can get to people sooner, it would be terrific. So, you know, what we all can do to help reduce the stigma and really helping promote mental wellness for everybody, because I'll tell you, pretty much everybody is impacted by it. If you think of our family and our friends, we know someone with depression, we know someone with anxiety, we know somebody with addiction disorder. It's everywhere. And so the more we talk about it, and you know, that's been, I keep saying, and I know we've all been saying that, the silver lining of the pandemic is that people now, because they've felt depression, they felt anxiety, you know, maybe engaged more in, you know, substances misuse, now have more empathy for this and understand it. And so we are talking about it much more. So know the facts, educate yourself about mental illness, including addiction. You know, there's so much judgment around addiction, and that's a whole other piece. be aware of our own attitudes, you know, how we're coming across and what are the words we're using. And pass on facts, you know, get information. Help change and challenge when you hear people using terms that could be offensive to other people. And they're not doing it intentionally for the most part, but just maybe unaware. And focus on the positive. Do any of you know celebrities? I love it when celebrities or high-profile people come out and they disclose their challenges. Do any of you here think of somebody right now that's come out and was courageous enough to self-disclose? This is called Stump the Audience.
Yeah, I know there's been a lot recently in the last couple of years, but my brain can't think of a name right now. That's
Sure.
so much in my head
I
right
know
now.
Selena Gomez has.
Depression?
Yeah.
Yes, really impacted with depression. Michael Phelps,
No.
ADHD and depression. Drew Carey tried to commit suicide twice. Terry Bradshaw, quarterback for the Steelers, and now a commentator. He tried to commit suicide a couple times due to his depression. Maria Carey, depression. Look at Van Gogh, right? We have the Van Gogh immersion experience. Has anyone done that recently? Gone to attend that? It's great, it's fabulous. But here's Van Gogh, and he was a man with schizophrenia. And that's where, you know, when you have schizophrenia, sounds and noise and colors are so much more vibrant. You're very sensitive. And you can see that in his paintings. It's quite something. Elton John, bulimia, depression, addiction. Let's see. Buzz Aldrin, one of the first astronauts. Yeah, depression. Billy Joel, severe depression. Yep, addiction disorder. Yep, and a lot of time. Angelina Jolie, bipolar. So, Catherine Zeta-Jones, bipolar. So, Drew Barrymore, depression. So, I mean, the list goes on. But I feel so grateful when they come out and they say, I'm somebody who's struggling with this. Howie Mandel, anybody know Howie's struggle? OCD, he always has to wear gloves. He doesn't want to touch a real germaphobe, you know. And so really, I mean, when it starts impacting your quality of life. So there's so many people out there struggling, and there's good services in place, but we just need to be able to help reduce the stigma so that people can get the help they need and get the support they need and feel comfortable talking about it. So that concludes my presentation. Any questions?